I wanted to put a disclaimer. This is not medical advice. This is just personal, first-hand experience of the treatment my wife gets. So not medical advice, entertainment purposes only. This video is going to be about me talking about taking my wife to the hospital today. How crazy things are. We started out, probably today's Monday, so probably about 2 weeks ago, but not this past Sunday, so 8 days ago. We took her to a local place, like Sweetwater ER in North Augusta. And my wife was being short of breath, and usually it's her fluid, but sometimes she has like some infections that she has a hard time getting rid of. And we took her there. They did some tests, and they said, well, she was dehydrated on her kidneys, and then she had fluid on her, but they didn't want to give her Lasix by IV because they would ruin her. They were afraid they would ruin her kidneys. Now, we went in there, but she has a prescription for Lasix. If it's not working, she has to take more Lasix. So she steps on the scales. If she gains weight, she takes her Lasix, but if she gains more weight, she'll take more to compensate. So she's taking it oral, and she takes another medicine 30 minutes to activate it, which was helping. But sometimes she has to have an IV with the Lasix. It gets in her system faster than the oral medicine. So she's already taking it anyway. I just think the doctor just didn't want to do his job. And when I talked to the nurse, she said, come down here or go to the MUSC in Columbia. She said, only go to the other one. If she passes out, have to have the ambulance. They're only going to take you to the closest one. So then you'll have to go to that Sweetwater ER. So to me and my wife, she said, only go there if you're about to die. So I feel like Columbia's worse than Sweetwater. So you don't want to go there even if you are going to do that. So now hopefully we got to somehow get to Charleston. Got to get her some help. Probably this same doctor, we went in there probably 2 months ago, and he wouldn't do anything for her. And they happen to have a nurse there that's worked with heart patients. So, even though it's the ER, if they're not familiar with special cases, they're not going to do you any good, unfortunately. But he was going to send her home, just like he did this time. And he said, well, things could turn on a dime if you get worse. Come back. And it's like, I'm thinking to myself, well, we wouldn't have come here if we didn't think it was bad. She wasn't uncomfortable. Just because you sitting there all jolly like Charlie Brown. So anyway, I don't know. I just feel like some doctors don't care, or they're not able, or maybe their parents paid to get their degree and they just sitting there like, well, I'm not going to do anything today. So maybe it's not like that, but it feels that way. But so anyway, she's been hurting and suffering, and she gains weight, but she don't put it on her legs. It's all in her chest, and she has a hard time. So she was in the hospital like 14 times last year. So we really had to watch it. They don't want her eating out because of the salt and the food, and you had to really watch it. So if you can, take care of yourself, learn what you need to do, all the medical, advice and all, follow it so you don't get sick and get to a position. If somebody tells you something and it's sound advice, take it. Don't be stubborn and do what you want for years. or you'll pay the price if you're still around. So anyway, we called her little doctor that's been treating her, the specialist, and they usually run a lot of blood work. And said, well, if you're coming down here to Charleston, it's like 160 something miles to the ER down there. I'll let them know you're coming. But if you don't want to do that, you can go to the MUSC in Columbia, and they got all the records. They have everything that they should be able to treat her. Now, they don't treat for the heart, but they'll be able to treat for something else. So we said, okay, we'll try that. Or we could go get blood work by a local lab, and then he would get the results of it and decide what he needs to do, whether he needs to change her medicines or anything. So we said, okay, instead of going to Charleston, we'll just go to Columbia, which is like 60-something miles one way. So we go to MUSC, get down there, and it's really a weird vibe, man. The guys at the counter and the nurse that called me from MUSC, Charleston, she said to tell him everything's going on and her history. And he said, well, I'm just going to put in one little thing, because we figured she had a urinary tract infection. And then we figured we had fluid on her lungs. Usually they do blood tests and they figure out which way to go. Well, we was down there. There was a guy over there next to the wall sawing some logs. And I said, man, I bet that's what I sound like. I snore. There was an older guy, 70 years old, that fell, and he thinks he broke his hip, but he kept asking for a bag. So I don't know if they took his bag or if he had a little bit of dementia. And all these people were in here, and people kept coming in, the wives kept going to see their husbands. And I said, we was there about 3 hours. And they took my wife back. They made sure she had her insurance information. And then they took her, I don't even think they took her vitals, or maybe barely did her vitals. And that's it. And you got this emergency room, waiting room, it keeps filling up. They had a lady come in who was like gagging real bad when she first got there. But they brought her in by ambulance, and they put them in the waiting room, and she was making a lot of noise. And then she was able to get up just fine, but then she was hurting. So, I think she might have got where they give you that medicine to keep you from overdosing. Because when we left, it was like 8 something at night, and the guy's telling us he needs a ride to his AA meeting. Now, I don't know if that's true. Now, I know usually you have a sponsor, but it was kind of weird because he's like walking everywhere using the public phone. So I don't know what the deal was, but I was like, you can't just trust total strangers. So that, it's a bad, anybody's coming to this place. So the guy left, they changed shifts. 2 or 3 other people were sitting up there. So I finally went, after 3 hours and asked, and I said, hey, you guys, what's going on? And earlier I heard the guy say something about when people got close to being done, it had different lights on his computer light up. She said, well, I don't know nothing about that. That's day shift. Well, I don't know what they do. Well, you be seen when you be seen. I have no idea. I can't tell you. It's priority who's hurting first. Well, when they put my wife in the system, they just put her as a urinary tract infection. They didn't put nothing about her heart or breathing. She told them in check-in, but they didn't really consider her a patient. Because another lady come in there with just a little bit of high blood pressure. They took her for x-rays. Well, my wife's got fluid on her lungs, congested heart failure. They just treating her like they don't care. And then they couldn't tell me. And then some older ladies, both their husbands were in the hospital, So that guy made a joke about that. Said, boy, y'all must be some bad people. And both wives come up there to see their husbands. Well, they got there at 10 o'clock in the morning. Took them 3 hours and they were in a bed. Well, according to what the lady said, I didn't see them, but they were in a bed in the back, waiting to get a room. And it's like 8 o'clock at night, so they've been there, 10 hours. They hadn't even got a room yet. And then she said, well, we're only a 16-bed emergency room, And I was like, my wife said, I want to go. This is crazy. They ain't doing nothing for me. So I told the lady, she said, I got to check with the doctor and nurse. So I think she just kind of turned her halfway around her chair. She turned back and said, yeah, you can go ahead and go. I was like, good gracious. One guy had been waiting on results since 4 o'clock, and he needed it. So they do stuff for you, and then they send you back to the waiting room. They didn't even have anybody in the emergency room. So it's crazy. And the lady said, yeah, we got here, there was a bad smell. They had an emergency in the back. I don't know what happened. I don't know. But man, that's been one of the worst experiences. I thought Sweetwater in North Augusta was bad, with them just going and kind of brushing you off like, you're not sick. And I don't know if I blame it on what it is, because used to, I had good insurance back in 1990s, $10, and they cover everything 100%. And, it went up to like $1 million of lifetime coverage, and then now it even changed. Now, I think you got to pay like $2,000 a person or $3,000 a person to meet your deductible. So insurance doesn't pay anything until you hit that. And then it only pays 80%. Insurance is terrible. They need, some kind of national health insurance, because if that's the kind of insurance or treatment you're going to get now, where they don't care, you're waiting there hours and hours, what's the point? I mean, you paying all this money and you getting poopy treatment. I mean, if you pay insurance, people that got insurance should have really good treatment. So they ought to be able to have somebody come out there and really assess you, and they're going to have to create a robot or something to do it, because people don't care. So what I'll try to do tomorrow, I'll try to call the nurse again and say, hey, do you want her to get lab work? Or we're going to try to come down to the emergency room down there. So I had to take a bag because it'd be hard to come back. But man, it's crazy. Crazy kind of going to the doctors and they just don't care, and you still need help. I understand now why a lot of people get real sick. They don't want to go to the hospital. They said, I'd rather be at home. And we've had a couple of scares. Even that same Sweetwater ER told us before. They said, well, I talked to the doctor that did your last heart catheter. He said nothing's changed. There's nothing we can do for you. I know you're in pain and distress, but you just go home and have to suffer with it. There's nothing we can do for you. So I got him to call Charleston last year, and Charleston said, bring her on. They sent her by ambulance all the way to Charleston, and the ER was just going to send her home and let her go home and be uncomfortable and, possibly worse, because she had a bad infection. She's just a complicated case, and you got to really be smart to deal with her. So if you're just doing regular medicine, it's like you can't just take her to the pull apart and get another part and just change parts. I had to take her to like the Tesla dealership or Mercedes-Benz. I can't just take her to, Ford or a Ford car dealership. They're all certified, but they have no idea how to work on her. She's a Mercedes-Benz or a Tesla or Lamborghini, Only like 8 made in the world. Only 2 still running. She's one of them, and it's very complicated to work on. But, hopefully we'll get her fixed. But, man, just going to doctors and, I know they know what they're doing, but some of them don't know what they're doing in certain situations. Or maybe they got, they're human, so who knows? Who knows? But if you had to go to the doctor dealing with all the frustration, they say you can get a second opinion, but, they ought to have some kind of reviews or something. But, these guys, they ought to do better. Like my wife went 2019, she swallowed some okra and went to the hospital. And then they kept telling me, oh, you got to sign off on an emergency procedure. She's in the ICU on a ventilator because she asphyxiated on okra, but we didn't know exactly what was going on. We knew but she couldn't talk. She was like conscious, but not verbal. And she was on a ventilator for 8 days, a year before the pandemic. So we got really lucky. And there was a doctor that finally figured out, hey, she got okra in her lungs. We got to get that out. So it's amazing she survived that. But you got doctors, and then you got doctors, and then you got like the superheroes. So that's what my wife has to have, the superheroes. You can't just have the old regular doctor that works on a Ford or a shade tree mechanic. She got to have the highfalutin superhero doctor. So so don't give up. If you get a bad doctor, he might just not be certified to know what you're doing. You got to get a good doctor. Good reviews. It's worth traveling a little bit if you can get one. So good luck. I know going to the doctor is not easy, and it's not nice. And everybody that has this problem is probably going to be too tired to listen to me. But prepare. Try to do right, eat right, healthy, and all that stuff, because they did do tests on a bunch of people for so many years. And look at your family, how they do, because everybody's human, and we all have these problems, and we all gotta try to do right, or we're gonna pay for it, financially, or physically, or mentally, or both. So try to do the best you can, so you can stay away from the doctors. They used to have some sayings: an apple a day, keep the doctor away. So I like apples. I'm going to eat more apples. I like oranges too. But yeah, man, just wanted to share that. Going to the doctor is no fun, especially when they act like that. But y'all have a good one, and hope if y'all go to the doctor, it's good. And I hope your health's good. If it is, stay healthy, because you don't want to go to the doctor that's not a superhero. You got to have a superhero sometimes, so take it easy.